A dose-response function is convex when gains from increasing the dose exceed losses from reducing it by the same amount. This asymmetry is not a property of the patient. It is a property of the response curve itself. The curvature of the dose-response function determines whether dose variability helps or harms an expectation. Convexity is structural, not probabilistic. A physiological system is clinically antifragile when its expected outcome improves as dose variability increases. This requires the response function to be convex. Larger fluctuations around the same mean dose produce greater expected benefit. This is the clinical consequence of Jensen's inequality applied to a convex response curve. Variability is not noise. Under convexity, it is signal. 3 curvature types describe clinical response functions. A fragile response is concave. Dose variability reduces the expected outcome. A robust response is linear. Dose variability leaves the expected outcome unchanged. An antifragile response is convex. Dose variability increases the expected outcome. Curvature, not average dose, determines which regime applies. Convexity is a local property of the response curve. Irreversible organ damage introduces a global constraint. Once the damage threshold is crossed, the response function no longer applies. Clinical antifragility holds only while the organ remains within a recoverable range. Convex benefit under dose variability does not protect against crossing the damage boundary. Antifragility is conditional on survival. For a convex dose-response function, the expected benefit at a variable dose exceeds the benefit at the mean dose. This difference is the Jensen gap. It is strictly positive when the curve is strictly convex and dose is not fixed. A protocol that substitutes the mean dose for the actual distribution systematically underestimates expected benefit. This is a theorem about curvature, not an approximation. Convex benefit scales with variance. Greater dose variability implies greater expected gain when the response is convex, but convexity without a bounded downside amplifies damage as well as benefit. A response that is convex near the target dose may become concave or absorbing at extremes. Clinical antifragility describes the curvature of the response function. It does not describe a decision rule. Structure and strategy are not the same.